where people feel connected to what matters to them. We believe that at the heart of a happy, healthy Australia is a healthcare system that is more connected, more effective, and more accessible to everyone. Our ageing population and an increase in chronic illness means rapid growth in demand. Health professionals are working harder than ever. Patients can't easily access their complete records, and health professionals can't easily access all the information they need to make the best treatment decisions. Inefficient processes and a lack of information lead to duplication or costly errors. The very sick, remote, poor and elderly struggle to keep up with important care and monitoring. Even basic treatment and repeat prescriptions require a visit to the doctor. Imagine a smarter, connected way to delivering patient care. Imagine a more effective and accessible healthcare system where medical professionals can spend more time doing what they do best, caring for those who need them. That's why we're working with patients, doctors, hospitals, carers, insurers, government and universities to transform the future of Australia's healthcare system, where it's easier for patients to access their doctors when and where they need them, where routine repeat prescriptions are managed online, where patients can easily see their entire medical records and share them with those who need them the most. A future where the people who have dedicated their lives to caring for others can spend more time doing what they do best and less time on paperwork. At Telstra, we're working to make that vision a reality. We're assembling leading e-health capabilities and connecting them to create new solutions to solve industry-sized challenges. Overcoming Australia's healthcare challenges starts with creating a safer, more efficient and convenient pharmacy system, reducing hospital and residential aged care admissions, improving integration of health information, providing consumers with greater control over their health and wellness, and breaking down the barriers of access and distance. Our ability to connect and our technology leadership put Telstra in a unique position to help build a healthcare system for the future. A system that better understands, better diagnoses, better manages, and ultimately better cares for Australians in every corner of the country and from every walk of life, to ensure that their lives are as long, as healthy and as rich as they deserve to be. This is more than a transformation of an industry. This is change we need to ensure that Australia isn't just the lucky country, but the smart, healthy and globally competitive nation we deserve to be. Can you imagine a healthcare system as brilliant as that? At Telstra, we already have.
Well, good morning, and it's a great pleasure to have so many people here. It's just tremendous. And Sarah, thank you very much for the welcome. Well, I'm going to start with a little story, which probably most of you already know, but it relates to Sydney Hospital, just on our left, on your right. And I thought it would be appropriate because it sort of, I think, puts into context really what we want to talk about today. And for those who don't know, and I didn't know, but the Sydney Hospital actually started in George Street in 1788. Is that right? 1788. However, this building was built in 1811, which means it's now what? Over 200 years old. Now, actually, it was Governor Macquarie who was the protagonist and the visionary, and actually, my notes said the innovator around this initiative, because what happened, I understand, was that the governor said, look, I need to set up a hospital in Sydney, went to the British, and guess what they said? No money, can't afford it, and can't build it. So, of course, Macquarie being, sort of probably, besides being innovative, probably being a little bit entrepreneurial, he pulled together 3 businessmen. Now, I'm not saying businessmen are always good, by the way, this is not the moral of the story, but it was Blaxell, Riley, and Wentworth. And he did a deal, and the deal went like this. He said, look, if you would receive labour and supplies, this is what the business is. If I can get labour and I can get supplies and give me a monopoly on rum imports, we'll find the funding for the hospital. I'm not sure if they're getting patients to the hospital or whatever was going on then, but it was a very interesting strategy, because what happened was the contract allowed them to import 45,000 barrels of rum, which very quickly went to 60,000, so they did really well out of it, and we got a great hospital for Sydney. So I think that sort of was quite a significant moment, at least in New South Wales, and I hope that today this is as significant. So let me explain why I told the story. Look, the reality is, and I see it every day, is this digital world is changing everything. And I don't want to overplay it, but the truth is, and I am a patient, and I get all my records digitally, it is changing so many industries, and it is causing the ability to do things differently is happening every day. And that's what's so exciting, but at its core, and healthcare at its core, is about connectivity. It's about how you can get better information flows going between doctor, GP to specialist to pharmacist, as you saw in the video. So we're delighted today, and I'm not the expert, Gordon and Shane are, to be announcing really what we've been working on for 2 years, is how can Telstra play a critical role in really enabling that whole flow of information and creating value along the way that allows for better outcomes for patients, that really addresses, you know, where there's inefficiencies in information flow. And of course, the big challenge that we all know, and I feel, we're all getting older, and the population's getting older, and therefore this enormous cost burden that is, you know, really going to be up to probably my children to have to, you know, really fund in the future. So we think there's enormous benefits in driving a greater connected healthcare system. And in Australia, that's what we've been thinking about, how we can play a part there. But it's more than just connectivity. It is actually about how you enable the information flow through that. One very little story, and then I'll throw to Gordon. We were involved in Victoria with a very small project around breast screening. It was a really small project, but I tell you, it changed so much. And as you know, I mean, part of the challenge of Australia, we're what, 22 million people in a land mass of 8.5 million square kilometres. One of the great problems is the tyranny of distance in delivering good health care. And it was just this little project we did, this is going back 4 years now, where we enabled, you know, the van, the truck that goes around to do breast screening with wireless technology. And what happened was that, you know, when the screening was done, the image was immediately, you know, posted up into the cloud, and a specialist could look at it. Or a process that took 14 days suddenly became down to a matter of hours, and the patient could walk out with a diagnosis, save an enormous amount of money, and it was a better outcome. That's what the power of connectivity is. But there was a lot of things you had to do in there. There was regulatory issues. There were, you know, ways we had to, you know, work with the whole public health system. But I looked at that and thought, gee, isn't that great? And when you really create a better outcome for the patient, that's what we're about. And that's why Telstra Health, T-Health, is a very important part, a new part of our business. And we have taken a very long-term view on it, and we're excited about the possibilities in partnering with healthcare providers, with the whole community within the health care. We are not doctors, we are not medical practitioners, but we can enable, and that's what we really want to do. So with that, I'm going to pass to Gordon Ballantyne, who runs the division and Shane's a part of, and he's going to give you some more information. But thank you for coming. It's a very important day for us. Thank you.
Good morning, everyone, ladies and gentlemen. As you can see at Telstra, right from the top of the organisation, we have a vision for a better connected health system. As David mentioned, I'm Gordon Ballantyne. I am the Group Executive of Telstra Retail. Now, Telstra Retail is a $17 billion business. We connect and serve every single household, 8.8 million households here in Australia. We connect 16 million mobile customers. And we support and connect 1.1 million small businesses who are the powerhouse of our economy. And that's an extraordinary business, and it's a privilege for me to lead that business. But today, I'm not here to talk about Telstra as a telecommunications business and how we choose to connect everyone right across this great nation. What I'm actually here to talk about is the role we have chosen to play in connecting people, all of us, at our time of greatest need. When we need help, when our health fails us, when we need a different level of care. It's with that in mind that today Telstra is officially launching a new business division called Telstra Health. And I don't know about you, but I'm very excited. I know the team are here incredibly excited about the opportunity it presents. Healthcare is a really exciting industry. Every Australian at some point in their life will experience the health system. I'm sure many of you have, even in the last few months. Today we want to share our vision for a more connected health system. Today we would like to share with you an ambition to become Australia's leading provider of integrated e-health solutions to better connect all Australians in their time of need. And that's a very purposeful intent that creates a huge amount of energy in Telstra in our role serving all of Australia. As you know, and David mentioned, that the cost burden and the challenges facing the healthcare system are great. If we look at the current projections today, as taxpayers, that cost is about 120 billion, and the rate of growth of cost is twice that of our economic growth. So by 2020, it's predicted that our health costs will reach 200 billion, driven by aging populations, an increase in chronic disease, and improvements in access for everyone. These are just some of the challenges that all of you know really well. Our shared ambition is to bring quality healthcare to every Australian across what at times is a highly fragmented system. Admissions are unnecessarily high. Every year, 3/4 of hospital admissions could have been avoided. Approximately 20% of elderly patients are readmitted to hospital within a month of discharge because care is not coordinated well in the community. Because the system isn't integrated, 1 in 6 pathology and radiology tests are duplicates driving waste into the system. Many Australians have a different experience of healthcare because of where they live. The 7 million Australians living in regional and rural and remote parts of Australia will only visit or have an interaction with a GP 3.5 times per year. The national average is 4.1 times a year, so we're clearly delivering poorer health outcomes in regional, rural and remote Australia. As you saw from the video, 1 in 5 medical errors are due to incomplete patient information. And as you know, there's 200 million scripts written every year, 40% of which are repeat prescriptions requiring a visitation to your GP. Telstra Health is a brand new business whose sole purpose is to bring integrated solutions together to help providers and funders to care differently for all Australians. With Telstra's heritage connecting communities across the nation, I really feel there's a different role we can play working together. We have seen what the digital revolution has meant to other industries, and we believe that healthcare in Australia could benefit from e-health to better serve all Australians. We see our role as integrating e-health solutions across all care settings to solve our industry's challenges. Telstra is about connecting you to your doctor to other providers, having access to care and information where you want, when you want. The health system itself has been highly fragmented and has not undergone significant digitisation. I think many in the room would agree to that. So I'm sure you will agree there's a huge opportunity to improve efficiency and productivity across the whole system working together. We are working in partnership with providers and funders in the health system to accelerate that digitisation for the benefit of all. And in the process, together we can create an easier system while at the same time driving greater efficiency and better outcomes. Telstra Health wants to be the partner of choice in the health industry. To connect patients, healthcare workers, hospitals, pharmacies, governments, health funds to build a safer, more convenient way of managing health, which I know is everyone's aspiration in this room with all of the representations of all of the organisations represented here today. We've already made progress. As David said, it feels like 2 years, but actually it's only been about 12 months since we launched our e-health business and Telstra Health business. Through acquisition and partnership, we've invested over $100 million over the last 12 months. The team has assembled 10 of the most innovative e-health companies from Australia and around the world to create leading integrated e-health solutions, including some of those solutions we're announcing today. Through technology, we can reimagine a different health system that's highly connected, it's highly digital, that's integrated, that puts the patient at the center. But we can only achieve that if we assemble a team of health experts from across the globe with the experience to bring that ambition to life. I think everyone knows Shane. I don't know anyone in the health system that I've met who doesn't know Shane. But as you know, Shane is the Managing Director of Telstra Health. He used to be CEO of the Hong Kong Health Authority. 30 years of wonderful experience in the health domain, purposeful in applying that experience to help solve these national issues that we need to face into. And that's what is exciting about Telstra Health. We are working together, collaborating to solve issues that impact every Australian. And we are very purposeful in that intent, very purposeful. So to introduce Telstra's vision for a more connected healthcare system, I'm delighted to introduce Shane Sullivan, Managing Director of Telstra Health.
Well, good morning, everybody, and I can't say how delighted and somewhat humbled I am to see such an amazing group of people here today. I think of people that have been on this e-health journey for a long time and been fighting the good fight, and particularly people like Mukesh Harkawal, who is really a legend in Australian e-health, former president of the AMA in Australia and currently world AMA president. Peter Fleming, who's been fighting the good fight with NETA and setting really the ground rules for integration of health information in Australia. Chris Mitchell, former president of the College of GPs, and his CEO is here somewhere. So really we have, and I'm trying to figure out why you're here, and I'm sure it's not the food. I think really you're here because you see some hope somewhere. You see a health system that desperately needs change, and we've had lots of sort of false starts, dabbles, bads, whatever. And I think what I'm seeing in you is the belief that this time we might actually get somewhere. And that's certainly our passion in Telstra Health, but it's something we can't do on our own. So we started a little over a year ago, and we were determined not just to buy products and flog them. We were determined to really understand what solutions were needed in the health system for the pain points of now. And of course the themes came back as very, very consistent. Integrated health record. Why can't providers see the information they hold about each other's patient? Why can't I see my health record? Why is it that people, when they leave hospital, suddenly get lost and end up back in hospital? Can't we monitor and know what's going on with them more closely, more efficiently? What about productivity? There must be something in this digital age with productivity. Doctors and nurses do so much paperwork. 50% of nurses' time is actually spent on paperwork. Can't we achieve productivity without just making nurses and doctors work faster and harder. There must be a better way. Is there an easier and more convenient way to see the doctor? Can I get better information about my condition, information I can rely on? Can I interact with my clinician differently? What about safer prescribing? And an interesting one is health is awash with data, and people in this room know that. How about we make use of that data, what the US calls big data? Can we use that data to predict peaks in demand, like in winter or emergency departments are getting very busy and we need more staff? Or pinpoint improvements in the system where it might be more costly or where there might be quality problems. These are the themes, the big picture themes that come out of the health system, come out of you really, and that we believe e-health has a critical and central role to play. And if anything today, what we're doing is trying to bring e-health out from a cute little thing in the corner to being part of mainstream health system issues. And that requires scale and scope. The context of our challenge is the ageing population and chronic health illness. We all know that, but it's important to point out, what does that mean? It means that an individual person has multiple healthcare professionals looking after them over an extended period of time. That means those professionals have to somehow work together. Information and connectivity is the key to that. But we also know that doesn't happen smoothly, it doesn't happen seamlessly. The consumer ends up trying to join the dots with inadequate information, and that's why we end up with retests, retelling of stories, and people back in hospital or in residential aged care prematurely. That's the context of the need for connectivity. We're in a chronic conditions world, not an acute episodic world. So what have we done in the last 12 or 18 months, apart from talk to you, which we really enjoy? We've assembled a whole heap of e-health capabilities. We've done it in a very focused and strategic way. We've assembled capabilities in IT applications used by health professionals every day, such as Fred IT. We've invested and assembled consumer self-service tools, such as Health Engine, telehealth tools, iScheduler from the US and Canada, Entra Home Health Monitoring services from the US. We've invested in some of the foundations of the integrated health record, Verdi, working out of Peter Mack and the MARTA, the Instant PHR from the US. We've also invested in our foundation capabilities for big data analysis through bringing Dr. Foster to Australia, the leading UK health intelligence system. We've also invested in some of the things that are really important, that if information is going to flow freely, it needs to be secure, private, safe. And so that's why we've invested in Argus secure messaging, MediNexus, which transports images from radiology systems into GP and specialist software. So we're very excited about these individual capabilities. We've chosen carefully. We think we've got some extraordinary people in those companies, and they've developed a really solid position within their own individual market. But what excites us is what we do with that. Okay, so there are capabilities that can be drawn on, brought together to build totally new solutions that are not available in Australia today. And that's what I want to introduce you to. 3 particular solutions that we have built at Telstra Health using those capabilities, and really to announce our intention with those, but I'll get to that in a moment. One of the luxuries of coming to Telstra and starting up a new business is you get to pick your staff. And those of you that have walked into organisations that are very established know what a joy it is to be able to start with a blank sheet of paper. We build on top of Telstra's extraordinary commercial management capabilities, and it really is an extraordinary company. I'm delighted to see a number of the very senior people here from Telstra, my colleagues here today. But the team has some amazing people in it. People like Paul Naismith, CEO of Fred IT, Peter Young from Health Connects, both of whom have been really veterans. Peter, I hate to say that about you, but Peter makes a very good wine as well, by the way. But they've been veterans in innovation in e-health, and they've built up very solid presence. They have incredibly deep knowledge about the e-health industry. But we've recruited people that have a deep understanding and commitment to healthcare. People like Dr. David Dorgan, who was clinical informatics head in Hunter, New England. Hunter, New England, I would say, is the leading area health service in Australia in introducing telehealth and integrated health information. He's been there and done it on the ground. Dr. Adrian Nowitzki, who is a practicing neurosurgeon and former CEO of the Gold Coast Hospital Health Service, who is running our health analytics, health intelligence unit, including Dr. Foster. Bronwyn Pike, who was Health Minister, my boss previously, and Bronwyn, I can say confidently, is the only health minister in Victoria to have invested in health IT, and that record still stands, Bronwyn, by the way. Michael Boyce, who comes to us after 10 years as CEO of Australian Home Care Services. This is a fantastic team that we've assembled, and that's not even mentioning the rest of the team who are very smart, very committed, and really want to build this business for the national benefit. So with that team, I want to announce 3 services that Telstra Health has already built, as I mentioned, using the capabilities that we've assembled already. The first one is an integrated community telehealth service, and let me try and describe the problem. Stephen Marpleton, I think is here today, for CEO of the Royal District Nursing Service in Victoria, came to us and said, my nurses travel 10 million kilometres a year. They may as well have trained to be chauffeurs and drivers rather than nurses. Half the time they're going to check on a person's medication. Can you build for us a solution that allows us to keep a closer eye on those people, know what's happening with their condition, interact with them regularly, but not have my nurses travelling 10 million kilometres a year? So we built that solution, which joins together, I think for the first time I've seen globally, a portal for care coordination, which is accessible to the family, which is also the video conferencing portal and home health monitoring, biometric monitoring. So it pulls together 3 quite disparate technologies, all in their own right have value, but together they transform how home care services can be delivered. So what I want to announce today is that we're delighted that Silverchain, the Chris McGowan, CEO of Silverchain, I think has also come from Perth today. I can't see you, there's too many lights. So. Chris, thank you. Silverchain is an innovative organisation, home care organisation, one of the leading ones in Australia. It provides 3 million services a year, 2 million hours of care to 100,000 Australians with 3,000 staff. It has a reputation for innovating in e-health. So we're delighted they have chosen that platform to introduce to their hospital in the home program. This is a program that allows people to not be hospitalised or to be monitored at home immediately after a hospitalisation. It avoids the risk of rehospitalisation. It is a fantastic service, and we're very delighted that it's been chosen, and we think it represents how healthcare at home will be delivered into the future. So thank you very much, both Stephen and Chris, for working with Telstra, and I think it illustrates our general approach is we want to know what the problems are, we want to build solutions that solve those problems. The second service I want to announce today is addressing an area we feel passionate about, and that is Aboriginal health and health in isolated communities. How is it that we can bring the best specialists in Australia, the best care in Australia to people wherever they live, even in the most remote locations? So the Chief Information Officers of Australia decided they wanted a telehealth connection service, something that would be a foundation for connecting video consultations around Australia. Northern Territory Health was given the responsibility to design this, work on this. They chose Telstra Health as their partner to build it. And I want to particularly acknowledge Michelle McGurk, who's in front row here, and you'll see her she's much bigger in there actually. So I think I want to show you the video and just emphasise that this is the way that we want to work with you as partners.
Seven million Australians live in regional, rural and remote areas. Patients in these communities are much more likely to have a chronic illness and yet have less access to medical care. Delivering care to these communities also comes at great cost. We believe brilliant connected healthcare is within reach of all rural Australians, which is why we're building the National Telehealth Connection Service. When you have remote health centres dispersed over 1.3 million square kilometres and hundreds of different language dialects, you need a different approach to healthcare. In partnership with Telstra Health, the Northern Territory is using technology to overcome the tyranny of distance, allowing the delivery of better healthcare for all Territorians.
Patients in remote locations have previously had two choices in accessing specialist services. Either travel to the doctor, sometimes hundreds of kilometres away, or wait for the specialist team to visit the community. Travel logistics both into and out of remote communities is complex for patients and providers alike. Since the introduction of Telehealth NT, communities in the Northern Territory have a new way to access quality care. Not only is telehealth proven to be cost effective, it also allows patients to become involved in comprehensive end-to-end services whilst presenting at their local primary health care provider. For remote staff, receiving professional development and being involved in specialist service delivery reduces the isolation and provides clinical support. For community members, telehealth enables virtual visitations and family meetings, ensures patients and primary carers are engaged with plans, and ensures timely follow-up whilst being supported by the local service. This project creates equity through extending telehealth delivery to Aboriginal controlled medical services. Improved access to healthcare translates to improved outcomes for patients.
As Chief Information Officer of Northern Territory Health, I'm excited to be working with Telstra Health in developing a national telehealth connection service. This is a project that can transform the delivery of healthcare across our country. That's why the National Health CIO Forum recognised the importance of achieving a clinical grade telehealth service based on agreed national telehealth standards. This exciting initiative breaks down the technical barriers that currently exist within telehealth networks in Australia today. This solution will break down the silos and allow patients and clinicians to connect to multiple health service partners. Telehealth connectivity and interoperability is enabled through a cloud-based connection service, allowing any health service provider to make seamless, quality connection to one or more other health service providers. This service has the potential to become a national service that will greatly benefit consumers, health service providers and healthcare organisations, spanning the public, private and aged care sectors.
We're working to connect communities, increasing access and improving convenience for patients, families and clinicians, and to shape a brilliant connected healthcare future for everyone.
So I hope you can imagine that as the way Australia provides health services in rural areas right across the country in the future. We certainly can. The third announcement I want to make is quite different. There is, I think these days we're not quite as patient as we once were. I can actually remember standing in a bank queue and waiting for a teller, waiting to get to the front of the line. These days we want to do everything online, and that is our expectation. It's a transformation that David talked about that's occurring very quickly. When we looked at where e-health was going globally, we noticed that in US, other European countries, what was happening is that there was a growing desire and a growing provision of services, direct consultation, direct clinical services online without visiting doctors face to face. For example, Kaiser Permanente in the States provides 20% of its overall consultations over the phone or video. We thought, wouldn't it be fantastic in Australia if we could bring this here? For people who are living in rural areas, for people who after hours can't see the GP, it's either not open, so they go to the emergency department. At the moment there are 2.2 million GP type consultations in Australia, in emergency departments I should say. Or people who just cannot get to the doctor, they're too sick, they don't have a ride, they don't have a car, whatever reason. Wouldn't it be great if we could just conveniently, for low complexity services, interact with the doctor online, either phone or video. So we looked around the world for who we might partner, who's nailed this, who's got this right. And we discovered a company called Medgate, and Medgate is a Swiss-based company which has been at this for 13 years. And I want to welcome Jianin Zog, who is a founding member of Medgate, so he's been in this game for 13 or 14 years and has helped us bring this service to Australia. The telemedicine service we're announcing is a service that is called ReadyCare. It will be available 24/7. It will enable a person to be able to ring or video a GP, receive a full consultation that goes well beyond just advice. It includes prescribing, it includes specialist referral, and of course diagnosis. It's a very exciting development for Australia and something totally new. We chose Medgate because they have proven that they can do this safely, effectively. They've worked out what conditions are suitable for telemedicine. They have an extensive training program, 3 months before a doctor can start taking telemedicine calls, at audit, outstanding supervision, and just a fantastic system. We were very surprised when we went to visit it. We will be setting it up as a national service, but we are also committed to working alongside GPs to try and complement the services GPs deliver. And we want to do that in 2 ways. First, if a person has a telemedicine GP consultation with our ReadyCare service, their normal GP will be notified. If they don't have a normal GP, we'll encourage them to get one because we think it's fundamentally important for continuity of care. Second, we want to work with GPs and the professional colleges to establish the platform to make it available for a GP's normal patients, not just through the national service. It's a very important strategic direction for us. We're interested in telemedicine being ubiquitous in Australia. We have to prove that it works, and we're very confident about that with the clinical advisory panel that we have, including Chris Mitchell and others. We're very excited about this actually, because it is something that people talk about, but it takes Telstra to really have the scale and the long-term vision to be able to invest to make this happen. So this will be a service that we hope will eventually again become the norm in Australian healthcare. So we're out to create a new world. We've given you a few illustrations of the type of new services, new things we're creating. There's many more that are yet to be created that I know a number of you are asking for, and we look forward to working with you on that. So I guess just in closing, what's the vision? How do we know that we've arrived? Well, I think it's when consumers interact with health service providers using modern technology and not have to constantly wait in doctors' rooms or wait in emergency departments or in outpatient clinics. When patient information is integrated and all those involved in a person's care have access to the information each other has got. When you and I receive our pathology results, our radiology results online, and when we can share those with people who we trust. When medication errors are reduced because information about what pharmaceuticals a person is on is shared widely. When repeat prescriptions are easy to get online, of course done safely and appropriately. When digital technologies win back time from our medical staff so they don't have to spend their time on the road or in administration, but with patients for what they were trained to do. When people get access to the best specialist care no matter where they live. When the demand on hospitals and aged care services starts to decrease because the way that we follow people at home and coordinate care at home is as good as what they can get in the hospital. That's our vision. We look forward to working with all of you to create it. We're grateful for the support that we've got already, and it is an exciting future. Thank you.
Imagine a future that puts the patients of today and those of tomorrow at the centre of a connected healthcare system designed to provide the best possible care for all Australians. At Telstra, we're working to make that vision a reality. We're working with patients, doctors, hospitals, carers, insurers, government and universities to transform the future of Australia's healthcare system, where we help bring patients closer to their doctors when and where they need them, where routine repeat prescriptions are managed online, where patients can easily see their entire medical records and share them with those who need them the most. A future where the people who have dedicated their lives to caring for others can spend more time doing what they do best. At Telstra, we believe in a brilliant connected future for everyone, where people feel connected to what matters to them. We believe that e-health is the key to connecting patients with the human care they need when they need it. And we believe that at the heart of a better, healthier, more productive Australia is a healthcare system that is more connected, more efficient and more accessible to everyone. A system that better understands, better diagnoses, better manages, and ultimately better cares for Australians across the country and from every walk of life, to ensure that their lives are as long, as healthy and as rich as they deserve to be. Can you imagine a brilliant connected healthcare future like that? At Telstra, we already have.
I hope you've heard in our speakers today Telstra's absolute commitment to continue to work with you to solve the big challenges facing healthcare. The new solutions we've announced today to make healthcare more convenient and more accessible and to reduce hospital admissions are just the start. We'd like to ask you all to continue this conversation outside and to see some demonstrations of our products and solutions. Thanks again for being here with us today. Can we ask the media please to come to front of stage to Steve?